You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have Dr. Douglas Wright. Dr. Wright, welcome to the program.
Hello, Mr. Alvarez. How are you?
Good, good. Now, I know you brought a lot of photos, so we'll get to as many of those as possible.
Sure.
But for people that don't know your practice, who's the typical implant patient?
I'm looking for two kinds of patients. One patient is a patient who has no teeth. And we know about 60 million people in the United States have no teeth.
Okay.
And they kind of fall off the radar screen as far as the dentist goes. And the other type of patient there are patients in my life who I've seen over the years, Randy, who know they're heading for dentures, who think they're heading for dentures, and I can help them. The kind of symptoms they had, the people I'm talking about that are heading towards dentures are suffering. They have bleeding gums, they have cavities, they go to the dentist again and again and again. They get repeated treatment that doesn't seem to satisfy them. They don't have a confident smile. They're not enjoying life as much as they think they should. That's the people I'm looking for.
Okay, and the denture wearers, you say you could almost help the most. What do you mean by that?
I don't think when I was in dental school, we were taught nobody's going to wear a denture just attached to nothing in the future. Well, Randy, the future's now.
Okay.
We can attach dentures to implants in your mouth and give you a whole new outlook on your life. It changes everything, Randy.
So it's more than just teeth.
Oh gosh, yes. It's your smile. It's what you choose at the restaurant. You know, a lot of patients, they go to the restaurant and they don't have comfortable, confident teeth. They look at the menu, they have to figure out what can they eat, not what they want to eat.
Okay.
This changes everything.
All right, now, are there a lot of people wearing dentures where you are? Like in like 100 miles of your practice?
Oh my gosh. We could fill a sports stadium, like the stadium at Virginia Tech, Lane Stadium, 65,000 people. I did the math. We could fill that stadium with people who are wearing dentures and then some.
Okay.
No doubt about it.
So if implants are so good and there's so many people wearing a denture or headed to dentures, why aren't they all coming in to get a new set of teeth supported by implants? What's your take?
Well, things have changed so much in the last 10 years. Many of these patients have dentures and they just fall off the face of the earth. They don't come to the dentist.
Okay.
So they don't know what's available and they haven't had a chance for a dentist to talk to them. Randy, you have to understand what the life of a lot of these patients is like before they got their teeth out.
Okay.
They went to the dentist time and time again. There were crises right before Christmas. They had 2 teeth taken out. They had a root canal that failed. They had other issues in their life. They couldn't smile at their kid's wedding. And finally they got their teeth out. And finally they got a denture and they thought, no more of that. I'm not going to have to go through that anymore. But what happens is, you know, and other people know, that the gums change their shape. And as the gums change their shape, the denture fits poorly. It doesn't fit as well. Okay, and then your mouth was never designed to have plastic sitting on the gums and give you any kind of biting force at all. These patients who wear dentures, they can't eat a carrot. They can't eat an apple. Not the way you and I eat it.
I know a couple of denture wearers. They never complain about anything.
Right. Why? Well, let me tell you what. You come to my office and you can hear them complain, because they complain to their dentist all the time.
Right. Okay, good point. Not to me. They're not going to tell me.
An upper denture, sometimes we can get a satisfactory result. With a lower denture, almost never. Almost never.
So, is this the future of dentistry for sure? Like,
the future
20,
is now.
30 years, no more traditional dentures? Everything will be attached?
Of course. Of course.
Okay.
All right? I mean, everything in our life is changing, and it's changing quickly. The same technology that brings you the cell phone, smaller, cheaper, more reliable, is happening in dentistry. It's a crazy, wonderful world.
How old can you be to do this?
Oh my, I've got patients in their 90s, Randy. I have a wonderful lady, and I got to be careful I won't mention her name, but she came to my office. She's 93. Her husband.
Why would a 93-year-old want to do this?
Her husband's 92. You know what she said to me?
What?
I like younger men. But they came in the office and sat down. Now, I'm going to answer your question. Why would a 93-year-old woman want to do this? Because when she goes to dinner in the afternoon, and she can't sit with her friends anymore. Randy, this woman's daughter told me that her friends were her whole life, but she won't sit at the table with her friends anymore because she can't eat the food because the staff where she lives in the assisted living home are putting her food in a blender.
Okay.
Okay. Wow. So we were able to get her denture supported with a couple of implants. Very careful. I talked to her physician, made sure we had all our ducks in a row before we did the work. But within a week, she was joining her friends again. She was eating regular food again. Her life had improved. And this is the beautiful thing about what I do.
So age doesn't really matter? Like
no, age does not matter, period.
So 75 is young?
Oh,
in your
God,
practice?
yes. Oh, and that's the other thing. I'm glad you brought that up. You know, the fastest growing cohort in my practice are people over 90. And you ought to meet some of these
Really?
people. Man, they drive to the office. See, you don't realize it. You know why you don't realize it? A lot of these people look like they're 70.
Okay.
I've got
Fair enough.
a woman come in to see me, and I had to look at the chart. She's 90 years old. You look at her. If I showed you her X-rays to a group of dentists in a conference, nobody would guess that she's over 90. And we have more and more people like this over time. The number of people living in the United States over 90 years old has tripled since 1980, and it's about to triple again.
Now, in your practice, you say that people could come in on the day of the procedure with no teeth and walk out with teeth.
We do that all the time.
Is that right?
We
Okay.
do that all the time. And it's transformational. You know what I keep in my office for those patients? Every one of my treatment rooms has a box of Kleenex because we call it the Oprah moment. These people many times get emotional.
You know, we were talking in my green room, and you say you're not winding down, you're winding up. Like and I'm paraphrasing you slightly, but you're more excited about dentistry than ever.
Yeah, I am. I love it. And some of my colleagues are stepping
implants.
back. Oh, because of everything. Because of everything. You know, some of my colleagues are stepping back and I'm stepping up. I love what I'm doing. I just came back from Vienna, Austria, and I had 3 great days where I spent time in the office of one of the foremost oral surgeons in Europe, showing me some of the tricks and some of the ways that he works with patients.
For implants?
For dental implants.
Is there that much to it?
Oh my gosh, there's so much to do it. But the cool thing about it is once you get the implant thing, you have to understand implants are part of an overall plan for the patient.
Okay.
And the plan is prosthetic. In other words, the plan is get you your teeth, get you your smile, make sure you can eat the foods that you want. And implants are a tool in that.
Okay.
So if you don't have your smile, if you can't eat what you want to eat, you need to talk to me and we can see what we can do to help you. Implants will probably be part of the plan.
Yeah, but isn't it true? I mean, if you've been wearing a denture for like 10 years plus, you don't have enough bone to do this.
There's 2 things happening in your question I need to touch on.
Okay.
One is that the technology is changing. We can do more with smaller and smaller implants, okay? But the other thing that's changing is the patient's changing. So the patient who tells me at 35 years old when I got my dentures, they fit well. Now at 60, they don't fit. That's because his gums have changed, not because the talents of the dentist has changed, okay? You know, that 60-year-old man is still looking for the dentist who took care of him when he was 35.
So you can still do it. So you could still do it. If somebody's been wearing a denture 10, 15 years, you can do it.
Oh yes, okay. We can help everybody. Now there are limits to what we can do, but things have changed so much that if you're sitting out there watching this thinking, I'm not sure, I probably can't wear a denture, you need to come by and talk, okay? In my practice, we do a free consultation.
All right.
I mean, you walk in, we'll take a CAT scan, evaluate the bone, talk to you about what you want, spend an hour with you. Randy, it's free.
Okay.
Free.
So know your options.
Oh, of course. That's what the free consultation is about. It's just so you get an idea to understand your options.
You think where you are, you could wipe out dentures?
No, I'll never get to the bottom of the stack. There are just so many people who need this. Sure.
Yeah, but what about people with gum disease, periodontal disease, bleeding gums, bad breath, loose teeth? Are their gums too bad to do this?
If you're so serious that you've lost all your teeth from gum disease, implants are the answer. Okay. Because just the shape of the teeth and the way that your teeth interacts with your body is different than implants. So we can get implants in there and your gums are strong enough. And I've heard this before, Randy. People come to me and say, you know, I don't really think I can do this because I lost all my teeth because I had horrible gums. Your gums are good. Okay. We can work with you on that. Do it all the time.
Is that right?
Yes, sir.
Okay. Now you brought some photos. What are we looking at over here?
This is my friend. I'm not going to. I got to be careful. I don't want to say his name.
Okay.
But this is my buddy. And I want you to look at this picture. He had no teeth. He was losing most of his teeth on the top. He was very frustrated because he had a plate that he wore that he kept losing, Randy. Guess why? He wouldn't keep it in his mouth. It didn't fit properly.
Like a partial kind of a denture.
Yeah, it was a partial, and then he had another one, and then he had another. He had 3 of them. He was very, very frustrated. So look at that picture again, and look at what he's got. He's got a great beard, and he's smiling because I asked him to, but he doesn't smile like that naturally. But he's one of these guys, Randy, he really looked good with a beard.
Okay.
This is post-op after I did his teeth. Look what he did.
Wow. Looks
He's
like
a good-looking guy.
Looks
Right.
like a different guy.
He shaved. Why do you think he shaved, Randy? Because he likes his smile. You know what he said to me? And he sat in the chair. I'll never forget this. He said, Dr. Wright, I'm going to tell you something. People treat you different when you have a smile.
Wow,
People treat you different. Now, he's in business for himself. In his business, he has to talk to a lot of men who are very, very affluent. That's all I'll say about it. But it gave him confidence, and it gave him an ability to approach people and approach the world without that thing that was holding him back. And we talked about this a little bit before I came on your show, about some people have this thing that holds them back. And it may be, so many different things. But so many times in my practice, I see a man or a woman who comes in, and you can just tell that there's a person in there.
Like an insecurity.
Oh my gosh, absolutely. I mean, you've seen it. You go to a restaurant and you look at people talking, and they do this while they're talking, or they do this while they're chewing. I call that the denture salute. Okay, and we see it all the time.
Okay.
Well, it's 1 in 4, 1 in 5 people in this country are wearing some kind of plate.
And you could spot them.
Oh,
the denture wearers.
a mile away. A mile away.
But you can't go up to them and say, "Hey, I can give you a brand new set of teeth, supported by implants."
I'll tell you another story. Well, you know, I'm from the Shenandoah Valley, and we have a lot of very hardworking people in ministry in the area. They have small churches, big churches. One of my, you asked me, who comes to you for this kind of care? I have a lot of pastors in my practice, okay? And the reason they come to me is that they need that security. Now you think about a pastor, you think about a pastor in a small church, okay? Friday night, he gets a phone call at 10 o'clock at night. He's got to come down to the hospital. Somebody in his church has been in an accident, okay? He's there maybe till 2 in the morning with the family, helping them sort it out. Saturday morning, 10 o'clock, he's got a wedding, okay? Or maybe, no, he'll have a funeral in the morning, okay? Saturday afternoon, there's a wedding, okay? He's got to go home, probably take a nap and a shower, work on his sermon for Sunday. This guy doesn't have, man, and I have some women, they don't have time for the paste in their denture. What are you going to do? You put this thing on before you talk to people about the reading in the gospel this week? It can't happen. So very quietly, because like I said, I didn't bring as many pictures as you were asking me to, because a lot of these folks, they don't want anybody to know they're having dentures, and they don't want anybody to know they have implants. But we fixed them. We give them that smile. We give them that confidence.
Is that right?
Yes, sir.
So you see personality changes like every single week in your practice?
Oh, yeah, absolutely.
Now we should mention, at your practice, I guess the way dental implants are normally done is you go to one place for the imaging, another place where they do the surgery, and then another doctor puts the teeth on top.
Right.
You do it all.
We do it
right
we do
there.
The goal is to do it all in one place.
But aside from convenience, what's the big benefit?
Well, remember what I said earlier in our talk is that, you know, implants are a small portion of the overall treatment plan, okay? Implants are a component of a restorative plan. And what that means
to get teeth.
Yeah, in other words, you have to have the vision of where those teeth are going to be and what they're going to look like before you plan the implants. Okay. That's incredibly important. 5-10 years ago, we did that. There were imaging centers, and I'd send patients to the imaging center, and there were specialists who put the implants in. I'd send patients there. But what I saw is that this is a smile plan. We're going to customize your smile and give you a bite where you can chew what you want. Okay, that's the end result. You know, Stephen Covey said something really cool. He's got this book.
The business guy.
Yeah, he said, begin with the end in mind. You have to know where you're going to make sure you get there. And that's why I think if you have it all under one roof, if you have one guy who can design it, plan it, and deliver it, I think that's superior.
Is it less expensive doing it that way?
Well, in my practice it is. I'm working real hard to make sure it's less expensive and affordable for my patients.
Hey, you've been doing implants for a long time. You know,
Since
we jokingly said
2007.
until they crawled out of the ocean as a one-celled amoeba, and you were spotted it. But no, since the 80s. You've been studying implants.
Well, that's true.
Is that right?
There was an active program at University of Maryland when I was there, but where I really got on board is when I worked at the Veterans Administration. I worked for the VA in Washington, D.C. for 3 years.
In the military?
I was a naval officer.
Okay.
I retired after 21 years of service. I used to do weekend duty at Bethesda Naval Hospital, right down the hallway from where the president gets treated. And then I also worked at the Veterans Administration, and I worked with a marvelous surgeon there, and I would make the dentures and he would put the implants in, and we worked as a team.
Okay.
I found that it was hard for me to get that kind of collaboration in my practice in the civilian world. So I learned more about implants, and the more I learned, the more I saw that there was more things out there that we could bring to the patient than what was happening in my town in the Shenandoah Valley.
Okay, good.
Right.
So what do they like more? The way it looks or what they're able to eat when you give them new teeth again?
You know, the cool thing, I tell my staff this, is most times people come in and they say, I just want to eat better. But they always look in the mirror. They always want to see how good they look, okay? So yeah, it's a matter of function. It's a matter of how good they look. I would say, what did you ask me? Which one do they like more? I would answer both.
Both?
Yeah.
So some people could care less how they chew. They just want to look good. Sure. And they end up, and what can they eat, by the way? So let's say everything works out. They have a brand new set of teeth supported by implants. What can they eat?
Oh, anything you want. You know, we have a lot of sportsmen in the Shenandoah Valley, and deer jerky, or some of these fellows will go out to Colorado.
Deer jerky they could eat?
Oh, jerky, they love that, and they make it themselves. So you have these guys that are cooking up elk steaks and from their big trip out west, or they make a deer jerky, and sure, all that stuff.
So salads obviously are easy.
Oh golly, yes. And that's the other thing we talked about. Remember, we said that 90-year-old cohort is growing like crazy. You can't get there if you can't take good care of yourself. You have to have good nutrition. You have to be able to eat well. And you know what? You want to smile and thank the waitress for bringing you that nice salad.
So denture wearers,
Yeah.
right? There's a lot of them.
Mm-hmm.
They're not really chewing, you say? Like they're just kind of rubbing their food together?
Most studies show that denture wearers don't chew nearly as effectively as people who have their own teeth. Now, the other thing I'll tell you, in my practice with the 90-plus-year-old patients, I don't see many denture wearers in that group. The people that are making it to 90 and having a vibrant life after 90 years old are chewing well.
Okay.
Period. Randy, would you do me a favor, please? Go back to the before and after of the fellow with the beard that I showed you,
All
okay?
right.
You know, one of the cool things is if you watch the movies or TV show, you know, who's the bad guy? Bad guy doesn't smile. If he smiles, he's got a bad smile, or he's got an evil smile, you know?
Yeah.
Okay? If the good guy, okay, the hero, got that, you know, award-winning smile. I mean, that's what we see in the movies.
Yeah, poor
Look at
people.
this guy.
Like if they're trying to make a guy look poor, or a street
Or
person,
disadvantaged, sure.
they give him bad teeth.
Right, sure, and just the opposite. You know, there are some actors that we talked about off camera that are known for not being able to go on camera without teeth to get that bad look about them. You know.
Interesting.
So,
well, with him, it is a difference in visual. I mean, he looks like a
he
different
looks
guy.
good,
Looks
and
like a
he
different
knows
guy.
it. Okay.
He's more handsome.
His
for
wife
sure.
told him, "Shave. You got a great smile." Okay, and he did it because she's right. All right.
He looks younger too.
Right.
You
Yeah,
know,
he does.
So you say a smile can make you look more attractive.
Oh, absolutely. Sure can. Think about all the studies you read. I mean, any magazine, Health and Fitness magazine.
Yeah.
What are the top 5 things that people look for when they meet you, right? Number 1 or 2 or 3 is always a smile.
Yeah.
You know, if you're single and you go to a woman's magazine, what's she looking for in a man? Nice smile. Okay. You look at the cover of Vogue or some of the ladies' fashion magazines. Most times you see that smile, that award-winning smile.
So your smile's never too far gone.
No.
You could always help somebody.
Oh gosh, yes, absolutely. Especially now. You know, the telephone. You know, 10, 15 years ago, it was this box that you had in the car and you had to plug it into the lighter and all.
Yeah.
Now you have this elegant little thing we just keep in our pocket. It's more reliable. Right? Dentistry is the same way. Our ability to treat patients has gone exponentially every couple of years. So if you're a denture wearer and you've had them 5, 6, 7 years, and you haven't talked to a dentist, you're missing something.
Now, you made dentures.
Yeah.
Lots of dentures in your time.
Yeah, I have.
If one of your patients is watching this that you made a denture for, what do you want them to know about implants?
What you've heard about implants from your knowledge maybe 5 years ago has completely changed.
Okay.
And we can offer them. They're easier, they're better, they're more secure, and it's possible for me to give you a smile, the teeth that stay in your mouth, that don't come out. And I got to tell you about one of my favorite patients, and he wouldn't let me bring a picture in, but I did the Snap-on Smile for him, and he goes, "They move," and I said, "Well, they move a little bit because there's a shock absorber in those, but he goes, I want them in there permanent. What do I got to do for that?" And I said, "Well, you know, I looked at the plan and came up with the plan," and he basically grabbed me by the collar and said, "I want them in there permanently." Okay, because what happens, Randy, is once you get them in and they're secure with the Snap-on Smile, then you realize what you could really have. And that's what I want to talk to my patients about. Not only that.
So permanent teeth that don't come out.
Yeah. We take them out maybe once every 2 years to clean them and check on the implants.
And what happened to that guy?
He got them. He got them in there. He's permanent. He's not only is he happy, but his wife's happy. She's like, "Oh, thank you." He was worrying me to death about his teeth and how he wanted them in there permanently. When he saw himself for the first time, first of all, I felt like I finally satisfied the guy, and he was happy. He was contented. Okay, and I talked to you before. Some of these patients become very emotional. He wasn't emotional, but his wife was emotional because he was worrying her to death. He constantly talked about, these aren't just what I wanted. I want them to be in there permanent. I want them in there permanent. Now that's a different level of care, and we addressed that with him as we went. Okay, so even the plan can change in midstream.
So it's very common that a spouse or a partner will drag the other one in. They're sick of the nagging at home.
Yes, absolutely. Yes. Not only is it common, I insist on it. For the most part, I'll ask them to bring your spouse in with you. A couple times the ladies have said, my husband has never seen me without my dentures. I don't want anybody to see me without my dentures. I get that. But for the most part, I want the couples to work on it together. One of the things that I do with the patients when we do smile design is we do a try-in. I make sure that the patient sees what I see and they like what they see with their new smile.
Okay.
And I'll bring the spouse in for that too. And we get the spouses to be actively involved. Okay, wives are very much involved. She wants her husband to look as good as possible. Okay.
Okay.
And then the fellows too. They'll take a look at their wife, make sure that she gets to smile just the way she wants it.
So is that common that couples come in together sometimes?
Oh yes. Oh yes. We talk about the missionary patient. Many times typically the wife will come into the practice. She's so impressed and she's so pleased. She goes, I got to get my husband in here because he needs his teeth fixed. And that's a very common scenario.
Guys put things off, right?
Yeah, they do.
To the last minute.
Yeah, they do. And they don't want to be troubled, and they're not as...
What seems very painful? Is pain something they're really complaining about?
No. No,
Okay.
And that's the other thing. Randy, I did this for my mom. Okay, she had a need for dental implants. She's probably going to skin me if I say this.
Okay.
But she had a need for dental implants, and I treated her and then had her come to my house. And she said, Doug, I took one pain pill, went to bed, woke up the next morning, felt great. Did that for my dental assistant. She said the same thing. That's typically what I hear. If you have pain, it's only going to be a couple hours. Now, I did a case for a woman, and she was kind enough to do a TV commercial for me in my hometown. And she constantly wanted to say I had absolutely no pain. And she literally got up out of the dental chair and she went out for dinner with her husband. I said, you can't say that. Because, you know, it is a surgical procedure.
Yeah.
Right, it is a surgical procedure, and there may be some pain.
But during the procedure, they're not feeling anything.
Oh no, absolutely not. That's correct.
So we have time for a couple more photos.
Oh sure, oh sure. This is another friend of mine. Here's her.
So you say friend, but these are your patients.
You know, an old dentist taught me something, Randy. He said, my friends are my patients and my patients are my friends, okay? When you come in, we form a friendship with you. We really do.
Good, okay.
But this is her first picture, and she said, Dr. Wright, I don't like my teeth. I don't like my smile. And you can see she wasn't real enthusiastic about smiling. They have to understand, when you hold that up, that's right side up. Her bite was inverted.
Now that's got to be unusual to have teeth that bad.
That's not unusual. We see that kind of stuff all the time. You don't see it because you don't examine these people.
Or they don't smile.
And they don't smile. They don't want to smile. They're off in the corner in the restaurant. They're not part of what's going on. Look at her again. Look at what I asked her to smile for that first picture. Okay, now this is what we got when we were done.
Very nice.
Now, you see the smile and you see how good she looks, but she also tells me how much better she's eating. She says, Dr. Wright, I can eat bacon now. Now you think about it. You go out to a restaurant and you order a plate of food and you get bacon on there. You don't hardly think about it. She couldn't eat that for 10, 15 years.
So does everybody have that certain thing, like whether it's nuts or popcorn or whatever that they want to eat?
Yes. I have one fella, he was a grand guy. I got him all finished and we did a follow-up. And he talked about peanuts the whole time. So I got him a nice can of Virginia peanuts. We have great peanuts in Virginia.
Okay.
Right? Bacon is a big thing. Beef or deer jerky is a big deal.
I find it hard to believe that you take somebody with no teeth, you give them a permanent set of teeth supported by dental implants, and they can actually eat deer jerky.
Or turkey jerky, whatever they want. Oh yeah, oh sure.
Doesn't that make you nervous?
Yeah.
Because even with regular teeth, you don't really want to eat things that hard, do you?
But it make me nervous. But you see the sparkle in their eye.
But you can do
when
it.
they tell you, hey, I can do something I haven't been able to do before, and you help me do that. And man, where do I tell my friends?
So we are just a couple of minutes left, but somebody watching this, you can't save their teeth. They need a full mouth of extractions, or they're currently wearing a denture.
Right.
They go to your practice. What are their options when it comes to dental implants?
A lot of these patients are looking for 2 implants on the lower to hold in that lower denture.
Okay.
And what I've found over the years is that's not stable. And we have.
But you don't like that, you said.
No. These patients, when they come to me, they want that denture to fit in and feel firm. Okay. It doesn't feel that way with 2. It moves. So the options are 4 little implants on the bottom. We can snap the bottom in. Okay. And the patients that get that and like it will say, "Can you do something for the top?"
Okay.
A lot of times they'll say, "My top moves around more than the bottom because they're snapped in." So We put 4 implants in the top and snap it in, and then something magic happens. Then we could take that denture that they were wearing, that big suction cup denture up in the roof of their mouth, and shape it like a U.
Okay.
Okay, and then the roof of their mouth is exposed, and a lot of people realize a lot of taste buds are in the roof of your mouth. So everything tastes better, and you're able to chew better, all right? And then we can take it to the next level. Sometimes these patients say, like I told you about earlier in the show, he basically said, I like the way they snap in, but I wanted to stay in permanent. Can't you do something permanent? And indeed we can. And indeed we can. And you know, when I do a permanent set like this for people, I tell them, you can hang by your teeth at the circus if you want to.
Okay. So even like as little as 4 implants, you get a full arch of teeth that just are in permanently.
Yes.
And then you come
and
in
those implants that we're putting in for a full arch of teeth are becoming smaller and smaller and smaller, requiring less and less surgery. So if you're going someplace and they say you need a lot of surgery, we're going to take a lot of bone out of your mouth to make room for these big implants, you really need to come in for a free consultation.
This is why now you fly all over the world to learn this stuff?
All
you
over
said
the world.
You were just in Belgium?
No, I was just in Vienna, Austria.
Austria.
I was invited by one of the world's most foremost implant surgeons to come just hang out in his office with him for a few days. It was a great experience. I studied in Cartagena in Colombia, South America at the dental school there. And the surgeon who taught me there was from Rome, Italy. He's an amazing guy. I've been to Northern Italy to conferences there. All of this to learn these techniques where smaller is better.
And what used to take you guys like 9 months now can happen in a few visits.
Yes, that's
correct. Or
correct.
as little as a few visits.
Yes, that's absolutely right. That's right.
So
it's less visits, less expensive, less surgery, and a better smile.
So no more dentures.
No more dentures. Not the suction cups and the things flopping around in your mouth. Absolutely not.
But what about maintenance? I mean, is it just like having your regular teeth once you get these
It's just like
in?
having your regular teeth, but better.
Okay.
Because remember I told you these patients go to the dentist, they had cavity after cavity and root canal and crowns and extractions. Now they come in, you don't get cavities and implants, all right? If you do what we ask you to do, you don't get inflammation around the implants. So it's a very easy
So a couple
appointment.
times a year, you just come in, get them clean?
Exactly right. And we do the other maintenance things. We check you for oral cancer, check the bite, make sure everything's comfortable, and it's a happy visit.
We are out of time. Final message to, maybe they've heard your message. They have either a loose-fitting denture or really bad teeth, but for whatever reason they're afraid or they're putting it off. What do you say to them?
I have a wonderful, friendly staff. It's a wonderful office in Staunton, Virginia, and we want you to come in for a free visit.
Okay.
We make sure that there's no barrier to this. You can come in, talk, we'll do the x-ray, whatever makes you comfortable. But we want it to be free. We want it to be easy for you to find out more about this.
Now we have to mention this, even the best dental insurance only covers a very small portion of implants. Medicaid for sure doesn't cover it.
Right.
Medicare.
Yeah.
So what's the answer?
Well, the answer is financing. We have in-office financing options, and we work with everybody.
I mean, you have to have decent credit. It's not like you're carrying it yourself, right?
That's correct. Okay. We work with everybody. We work with people who have good credit and good-hearted people who want to have a nice smile and an ability to chew better. We can help you.
Okay, good. I want to thanks for coming to the show. Good stuff.
Thank you very much. Thank you very much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.